When you're in labor, you're your own best advocate. You know your body, you know your baby, and your voice needs to be heard and honored.
A good clinician is going to answer your questions and make you feel supported, whether that's your OB or your midwife or your doula or your lactation consultant. And if you're not walking away feeling comfortable and supported in those answers, trust that. People just think that they go to the doctor and the doctor's supposed to know everything. But I've had this body for 45 years. I know my body, and that's powerful, and feel validated in that. And if you have a question about something, it is okay.
So important. I've actually had clients come back after asking some of these questions, and they said, oh, my provider said don't worry about it. Inside they knew that was really wrong, but outwardly they were conditioned to say this is my doctor and I should keep going forward.
You should not ever walk out of your visit with your healthcare provider and feel unsure, disempowered, doubting yourself. You should walk out feeling, I know what's going on. I know what the next step for me is. I'm so glad I went. Trust your body, trust your gut, trust your instinct.
Trust your gut.
When I first meet with the client, I'm constantly letting them know that, number one, I'm not there to talk for you. I'm there to enhance your voice. I'm not there to take over your voice. And I always have my clients to write at least 3 questions to ask the doctors because, again, I want them to get in practice of being able to use their voice because we're not going to always be with them.
If we are teaching our families to advocate for themselves, to be educated, to ask questions, and to trust in themselves, they have to be able to interact with a system that's going to accept them.
I can recall when I did a clinic visit with one of my clients, the doctor was ready to go out because she was trying to move to go to the next client. And so I had asked my client, I said, hey, you had anything to ask the doctor? And she pulled out her sheet and she was like, yeah, I wanted to know. And so she started,
nervous, huh?
Yeah, she started asking her and she turned around and she did answer her.
So you put that person in the spotlight and you create a space for her to grow. This is stuff that is going to come back when they are parents. You have to do the same advocating for yourself and for your child.
This speaks to the collaboration that's important and that's full of support. So when you go into a hospital setting, you'll have this interdisciplinary team. You can advocate for yourself. If you don't feel like you can advocate for yourself, then that you have a doula. Or you have a midwife that understands the importance of listening and respecting your wishes and trying to make your experience as close to what you desire as much as possible.
One of the things for sure is like as doulas, like however you want to birth, wherever you want to birth, we got you. In the hospital with an epidural, we have you.
Right. The moment of birth was surreal. I think that one of the highlights was that baby monitor on my stomach. They were having trouble monitoring him. I remember telling you, Tia, at that point, like, I worry that they're going to try to do a C-section. You told me because the external monitor keeps going off and they keep having trouble, they're gonna wanna put a monitor inside. And so I was like, we should do this other thing. That I was like, well, you guys haven't even asked me to sit up. Of course, I would love to get more sleep, but you know, if it's based off of like, you're concerned about his safety and I can get sleep, or you're gonna put this inside of me and I potentially get an infection, I'll not get the sleep. So
right, yeah, and you sat right up, and then the monitor was fine.
The monitor was
like
fine
right after that. Yeah, absolutely.
And everything was fine, and then we went into active labor not too long after that.
This mom I had worked with, she had previously used a midwife. And I believe that it was the midwife's no longer there. And she was used to delivering on all fours. That's what she did. And a lot of times you're in the hospital, they put you on your back because it helps them to be able to help you. She, on the other hand, she was saying, no, I want to deliver on all fours. That's what happened with my first baby. So what do we need to do? Do I need to get into bed and get on all fours? Does that help you? But I'm getting on all fours. That's how I'm delivering my baby. She actually got up there and she turned around and she put her hands like that and she delivered. She actually
That's good.
delivered.
Yeah.
And it was uncomfortable, but that young lady, she advocated.
Yeah, and that's what we have to do, Tikva. I mean, you know, as doulas, we have to actually make sure that they have all of the information that they need to be able to feel empowered and be able to be that person and say, yes, this is what I want. Yes, you know, this is the way I want to give birth.
How are you feeling about your relationship with your provider and your ability to speak up for yourself?
I think it's going well. I'm able to speak up for myself, and I feel like she listens.
Excellent, excellent. And so it can be kind of hard in a hospital setting because you're surrounded by all the experts, right? And I just don't want you to lose sight of the fact that you are the expert on you, right? None of these people know you better than you know yourself. And so in that way, you are one of the experts as well.
Okay.
And so I want you to feel confident to ask the questions to learn what you need to know, okay? Please don't blindly accept anything for face value because we're part of the team, right? You are the central piece of the team.
Yes.
So asking questions, giving yourself space to think things through so that you can make a decision that's good for you.
Ask yourself, what do I want from me? And understand that it's okay if it needs to change. If someone is hesitant or they're acting condescending or they're not answering your questions to the fullest extent that you feel satisfied with, know that you can always seek out another provider, call a doula in your local area where you can get those resources. And then look for advocacy tools. There are certain toolkits that you can use that are Know Your Rights framework in the birthing experience to really center you within your birthing experience. Be gentle with yourself. Have grace with yourself. And understand that it may not necessarily go the way in which you plan for it to go, but set aspirational goals and be fluid with your approach, and you'll be fine.